Good evening, everybody. Welcome to the Paradigm Shift. October is Breast Cancer Awareness Month, and today we're in conversation with Dr. Sanjay Dudhet. He is the senior consultant surgical oncologist with Nanavati Max Super Speciality Hospital. Dr. Sanjay has over 3 decades of experience in surgical oncology. He's performed many successful radical and supramajor surgeries in oncology in the last 30 years. He has 25 publications in national, international reputed journals. He has two research papers in breast cancer. He's coordinator in two international drug trials. He's organized many local, national, international conferences. He has been invited to over so many guest lectures on cancer and anti-tobacco awareness. He's completed over 500 audiovisuals at various places in Maharashtra on Akashvani and on television. He has received a whole lot of prestigious awards and he's a tabla player. Thank you so much, Doctor. We are honored that you have come to our platform to do this for us. Thank you so much.
Thank you very much for inviting me on this platform, madam, because cancer awareness is my passion since last so many years. And I started actively participation in this since 2005 onwards and doing
Okay.
regularly, right from my hospital to all suburban areas, all to village, everywhere, slum areas I have gone and did it. That is, the mission is only one, to give the cancer awareness should percolate at the periphery of India's and Maharashtra. That's what I normally believe that. And without that knowledge, it becomes very difficult for people to accept that whole thing.
Amazing. That is amazing. Thank you so much. So we'll get right into it. We have like a whole lot of questions to cover. We're going to demystify cancer. We're going to break a lot of myths. We are going to give you causes and preventions of cancer. So let's get right into it.
Correct.
So, uh, Doctor, why are people afraid of the word cancer?
I'll tell you one thing. I don't know why people are afraid really, because whenever I was going close to the people in on my all audio visuals, I used to ask first question to the people, what is cancer and what do you know about this word? Out of 100 people, only one person used to give me a correct answer. Rest 99 were absolutely unaware of this word, meaning of this word. Then I said, when you don't know the meaning of this word, why you are afraid? First thing. So people doesn't have awareness about that, because what we have to tell them is cancer in early stage. Stage 1 and stage 2 is absolutely 100% curable. Even stage 3, we do some patients cure 25% with aggressive treatment. And this message should go. And and people fear about the whole thing because they feel that cancer means death. No, it is not like that. Cancer means not death if you detect early. If you are alert enough to detect early, there is a prolonged survival. There are so many patients we have seen. So that is unnecessary fear which has been there in the whole society. That is not only fear of cancer. The fear includes the cancer aggressiveness. Fear includes treatment, everything. Fear including the financial problems also at the same time. Yeah. So all the things at one time they are coming together, and that is why this fear, and we have to get rid of this.
Right. Overall, can you tell us about the rising scenario of cancer? Like, why is cancer on the rise these days?
See, everywhere the cancer is rising, all over the Western countries, Asian countries, or country like India. Now, if you look at every year, we normally see around 1.5 crores new patients all over the world. And out of which almost 80 lakhs, they die every year. And if you look at the Western countries, their early detection is quite high than our country. And that is why death rates are more in our country than the West, because their detection is very early, so death rates are less. In our country, early detection rate is, if I tell you the percentage, you will laugh at it. It is 12.3%. That is early detection rate. Rest all come in advanced stages. If you have got 80% advanced stages of disease, naturally you will have a high death. So what we need to change, reverse. We have to make it at least 80% early and 10 to 20% advanced. Then the whole scenario will change and people will not
Right.
afraid about cancer. That is how the cancer incidence is rising. And that is why 4th February, we normally celebrate World Cancer Day for what? It is for early detection, proper diagnosis and treatment, and how you can reduce the death rates from all
Mm-hmm.
this. I think that
Mm-hmm.
is the main of the
Right.
whole this thing. Yeah.
Absolutely. What are some of the common cancers that are found in male and female?
Very nice questions. Now, if you look at the whole last 50 years scenario, if you look at the males in India, we take an Indian scenario now. In
Yeah.
India, we have got an oral cancer which is very, 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 very prominent in that because so many people are tobacco chewers in India. Almost 20 crore people are tobacco chewing. That is, any using the tobacco products. And
Oh my God.
almost 40% of tobacco product users, they can develop the cancers. 40%, which is very high. And that's why oral cancer, head neck cancer is very common in our India. That is number one. Number two, lung cancer is the next cancer which is common in males. Then the third is, which is coming up, is prostate cancer nowadays, which is coming up in a big way. We never used to see prostate cancer before age of 70. Now, the youngest I have seen is by at the age of 51. So this is how the trend is changing now. Now, this is, I'm telling you, common cancers. Of course, there are stomach cancers, then colorectal cancer. Chronologically, it will come down in males. But I'm telling you the prominent cancers. In females, the scenario, initially, it was cervical cancer was on the top. But now, in last 2 decades, breast cancer surpassed the cervical cancer. Breast cancer is number one. It is common in the urban population. Then second is cervical cancer. Third is ovarian cancer, which is creeping up. In that, the same level, we have got an oral cancer, we have got a lung cancer, then stomach colorectal cancer as a chronological order, it will go down in females. So this is how the common cancers which we are seeing in India routine.
Okay. What are the reasons for these development of these cancers?
Oh, it's a $1 billion question. Always people ask, doctor, cancer kaise hota hai? So it is not easy to explain. I always tell them it is not easy to explain you in 1 minute in my consulting or when you are meeting me in the corridor. It is basically, cancer is a multifactorial disease. Now, it doesn't come from one reason. It's very difficult to find out. But what are the problems, reasons which are been plausible reasons basically, is basically we are in a rapid urbanization era. Rapid urbanization, rapid industrialization is going on. So there is a lot of change of lifestyle which is going on. Then bad habits, tobacco, alcohol, smoke. All these three are persistently giving the cancers to all of us.
Okay.
Then coming to other aspects is there are certain, of course, change of food habits. We have got a fast food, change of habits, Western food. Our Indian vegetarian food, we are keeping it back. But with this food also, we are increasing stomach, colorectal cancer and other cancers too with the whole thing. So we have to see that our food has to be properly addressed. Then if you go another way is that there are certain viruses which can cause cancer. Human papilloma virus can cause cervical cancer. Then hepatitis B virus can cause hepatitis cancer of the liver. Then see, these are the HIV can cause certain lymphomas and sarcomas. So these are the viruses they can cause. Only cancer is not caused by the bacteria. So remember that it is not caused by any germs. Viruses is completely different. Then pollution, environment pollution is also contributing it. And another thing is that there are two factors which people doesn't account for them is increased population growth. We have got a 136 crore population. As the population growth increases, your cancer incidence will increase. And another thing, our increasing lifespan. Now, how it is related? Just look at our lifespan at the age of our, when we got a freedom, it was 47. Now it is come down to 73, 74. Average lifespan. Now, if you look at this average lifespan, once your age advances, your immunity and everything goes down and the cancer creeps up. So increasing lifespan also is one of the causative factors for the cancer. So these are the different causative factors for cancer, multifactorial. Only thing we need to find out. Certain cancer, we don't have causes also at the same time.
Okay. There is a question here, if you like to take it, from Mr.
Yes, please.
Surendra Kharai. If someone in the family has breast cancer, what are the chances of getting breast cancer in the next generation, and what precautions should be taken?
Ideally, can we take little later because we have not started the discussion of the breast cancer.
All right, all
We'll
right.
take a little,
We can
keep
start.
this question. We'll take
Yeah,
this little later when that
yeah,
thing comes there.
sure, sure. What are the alarming signals for cancer, if you could
Very
shed
important
light?
question. Now, I have taken, I thought of talking about this because people should know when we should consult a doctor. So, any white patch, any red patch on the oral cavity, tongue, cheek, need to be shown to the doctor. Then,
Mm-hmm.
any bleeding from unusual orifices like nose, then mouth, vomiting of blood, puffing of blood, or rectal bleeding, or vaginal bleeding, which is unusual, need to be shown to the doctor because we will need to take immediate action on that rather than waiting for a long time. Then,
Okay.
if you go further, is change of bowel and bladder habits, alternate diarrhea and constipation, which is classical for colorectal cancers, persistently happening for a long time. So these are all food related things also at the same time. Then, if you go further, is any lump in the breast or anywhere in the body need to be shown to the doctor. It may be benign, it may be non-cancerous, but need to confirm that it is non-cancerous. Or if it is a cancerous, then it to be to do further investigation.
Right.
Increase in size of the wart or mole, black moles can be a skin melanoma also at the same time. Chronic cough, long time chronic cough. It may not be cancer all the time, but it may be tuberculosis, which is treatable. Then hoarseness of voice, change of voice suddenly, but not coming back to normal for a longer time. Need to show it to the doctor. And I always believe, since we are sitting in the metropolitan cities, there are specialists which are available. Go to the specialist and show it to them. If you feel there is a connectivity of a problem with this mouth and the throat, go to the ENT surgeon, go to the ENT specialist and show it to them. If there is a PV bleeding, something gynecological issue, go to the gynecologist. If it is a breast problem, lump in the breast, and all these things, go to an oncosurgeon because that's more specialty, which is very important all the time. So unless proved cancer, people will not come to the oncosurgeon. But if you have a suspicion, please try
Mm.
to talk to them and clarify the whole situation.
Right. Um, since October is the breast cancer awareness month, so we should now,
Correct.
shed some light on breast cancer. And like you said, that cancer all over globally is rising. So could you tell us some incident details about breast cancer?
Now, breast cancer is a cancer which is rising very steeply for last 2 decades. And we'll
Mhm.
focus to our Indian scenario now. Globally, if you see, around 22 to 24 lakhs per year, new patients are diagnosed for breast cancer. And out of which, 6 lakh 70,000 on an average, they die every year from the breast cancer. Now, if you look at the Indian scenario, the Globocan data 2020, we have diagnosed 1 lakh 78,000 new cases last year. Now, this is now the highest trend up till now, and it is
Mm.
every year it is 25,000 cases are increasing every year. This is how the steep increasing. Now, this is the official data. The data which is not been entered in India, we really don't know. Then it is basically for urban females, urban female population. Villages, the breast cancer percentage is lesser. Now, breast cancer, it accounts basically around 25 to 32% of the patient amongst all female cancers. So you can see the almost 1/3 of the cancers accounts for the breast cancer, and it has surpassed the cervical cancer absolutely. And if you look at the deeper statistics again, then you have got to every 1 minute. Now, if this is a global one, every 1 minute we can see a new breast cancer patient. Every 13 minutes we have death from the breast cancer patient.
Oh
And
my God.
in India, 1 in 24 female will have lifetime chance of breast cancer. And if this percentage slowly goes up by 2030, it will be 26% rise by the next 10 years. That's what the overall study says, overall the researchers say. Now, this is the statistics I was wanting to discuss with the viewers so that you can get an idea why we should have proper awareness regarding breast cancer. Now in India and Asian countries like India, we have got a different scenario. Everywhere in the West, the breast cancer is very common after 50 and 60. But India, in last 2 decades, there is an age shift from 60, 50 onwards to less than 40. Now we are increasing number of cases from age 25 to 45. You won't believe in last 3 to 4 years, I have operated from the age 22 to 39, at least 16, 17 cases. The youngest was 22, getting post-marriage 6 months, post-marriage 2 years, or unmarried 27 years. We are all getting these cases in last and 10 years. It is very increasing. Now, what to answer to them? I think it is the biggest problem for an oncologist to deal with them. Such a small, you can say girls, because they, I mean, they are really in a very younger age group. Now, the young breast cancer is increasing in India. I still remember in 2012, I have attended the first young breast cancer conference in Dublin. And that time, that thing was very much disclosed. Because why we are studying all this? Because young cancer, they are biologically aggressive tumors, so that they spread faster and the recurrence is little on the higher side. Now, that's how we can detect early and treat aggressively. That is the main aim for this study, for this research, as well as for what we are doing, the awareness for the people, not to wait till the lump becomes bigger rather than ignoring it. So this is how the young breast cancer patient, and that is why if you look last 25 years, we used to see more than 70% patients above 50. Now, what is the scenario? We are seeing 48% of the patients below 50. It is the percentage is a lot of increase in the younger patients, and this is need to be addressed properly, because it is a big problem for the oncologists as well as the policymakers too. So this is overall the issue we need to address. That's why I took whole statistics in one time, because to know how the breast cancer is spreading, how the breast cancer is increasing, and how we should deal about the whole thing. And when younger patients come into action, we have to be more careful, because it's a very delicate issue. Yeah, a cancer is hitting at the age of 25, 30, 35. It's not good. It's very difficult to answer. I don't know how I have faced all this for last 4 or 5 years with these patients. But fortunately, all of them did well till today. And there is no recurrence. But anyways, we have to keep back of the mind how to follow these cases also.
That is alarming. I mean, the numbers that you're throwing are absolutely alarming. Okay, so if you could shed some light on what are the different reasons for breast cancer?
Again, I'm telling you, I repeat that two things. It is rapid urbanization and rapid industrialization. We are moving very fast. Our society is also moving very faster in a fast way. Now, that is why our lifestyle is changing in a very different way. Now, looking at the lifestyle after 40 years, I know during my younger age, how was the lifestyle, and today, how is the lifestyle? Big difference in that. Now, that is why it changes everything. People are not doing exercise. People are having odd foods. People are having fast foods. People are having bad habits. I mean, not sleeping at the proper time, not getting up at the proper time. Everything is haywire. And the answer is, doctor, we don't have time to follow all this. I think this sentence is killing everybody. I think we have 24 hours and we say we don't have time for good things. I don't think it is right. You do the career, madam. I do understand. But you cannot do career by putting the body into a problem. I think that is not the right. You must look at your body properly. So these are mainly things in the breast cancer also. Then what are the another aspects of that? Longer menstrual history is early menarche, that is menstruation starting before 12 and ending after 50, 55, late menopause. Because you are getting a lot of estrogen exposure all over the body, because for the body all over the years. And estrogen is basically, breast cancer is a estrogen dependent cancer. So that is a delayed pregnancy after age 30, 35. Because again, you are exposed to more estrogen cycle, because pregnancy will have progesterone, which will block the effect of the estrogen, which is a protective effect. Then breastfeeding must do for at least for 1 or 2 years, because what we normally do, Delivery within 2 months, go to the office, and no breastfeeding for the child. Will not do, because breastfeeding is so important. It is a dual advantage. One thing, you cannot produce mechanically in the world, because it contains such a superb immunoglobulins and nutrients. You cannot produce it. Number two, breast cancer feeding. Proper breast feeding will reduce the chances of breast cancer significantly. So these are the advantage of breastfeeding. Then women with no children will have high chance of cancer. Obesity, high fat diet, high body mass index will have high estrogen converted from that fat, will have postmenopausal obesity with other cancers. So obesity is one of the factors in breast, and not only breast, with the uterine as well as the ovarian cancer. Then coming to increase alcohol consumption and smoking, very bad for all the cancers. Why only breast? For all the cancer, one should stop. Now you have seen the young females are going towards this alcohol consumption, smoking, everything. Males do it, why not we? So this is how the things are going on. I don't think it is right. You should not compare bad things with others. And if the males are doing, you should stop them rather than starting with them. That's what I feel. And lastly, hormone replacement therapy, which we do normally after menopause, we have to be very careful about. And another aspect is hereditary breast cancers. Now, hereditary breast cancer is, breast cancer runs in the families, and there is a small percentage, but yeah, they need to take into account. Is one of the other reasons for development of breast cancer. So these are overview of what are the reasons which the breast cancer can be.
Okay, that kind of summarizes a whole lot of things. So, would you tell us about the symptoms and the signs of, like you said, early detection is good. So, could you tell us some of the signs for breast cancer?
Majority female comes with the fear in our consulting room is, doctor, I have got a lot of pain in the breast. Do I have a cancer? That is the
Okay.
standard things which we normally see. But pain in the breast is not a symptom of an early or operable breast cancer. It is a
Mm-hmm.
symptom of advanced breast cancer. But painless lump in the breast is the right sign of the having the breast cancer. Of course, all the painless lump in the breast will not be a cancer. That we need to see the characteristics by your clinical way of judgment and by your investigative way of judgment. So pain in the breast is not the criteria. Painless lump in the breast is the criteria. Another is change in the shape of the breast, skin retraction, then nipple retraction, then bloody discharge from the nipple. Then you are getting proper feeling the lump in the breast in any of the quadrants of the breast. And another, there is a dimpling of the skin and retraction of the skin. So these are the few signs and symptoms of the breast cancer. We need to be aware, and that is why we normally teach all the people a good self-breast examination before you go to the patient. That will come in later on in the discussion, but I'm just mentioning that symptoms and signs.
Okay, so Mr. Surendra, I think this answers your question. How can one look at early symptoms of breast cancer and detect it early? So, doctor has just
Perfect.
answered your question regarding that. So, moving on, different forms of treatment, if you could shed some light on that, a surgery,
Yeah,
etc.
with different forms of treatment, basically, uh, if you look at the breast cancer, before that, I would like to cover how we do the screening of the in the breast cancer patient. That is very important question before you
Okay,
go to the
okay,
treatment part.
okay,
Now, the screening of the breast cancer is due to, first is a mammography. It is called as X-ray of the breast. Second
okay,
thing is sometimes in a certain cases MRI of the breast or cell breast examination. Now, mammography is an X-ray of the breast. It has always been supplemented by the sonomammography, and which we normally start at the age of 40 as a routine screening till the age of 70. That is
okay.
normal study says. Now,
Mhm.
if the lump in the breast lady comes to us, we normally do mammography, establish it is clinically and radiologically there is a suspicious lump, and then we go ahead with the biopsy and further. Now, when we do MRI mammography, that we'll discuss afterwards when the genetic issue will come, and cell breast examination, very important. I would like to put a highlight on this because cell breast examination we advise from the age of 20 for all the females. Now, how to do it is a technical thing. It is already have got a video I have a video with BBC Marathi. You can go on the Facebook for cell examination. It is in Marathi. Very nicely explained. You can go to the technique point of view. But why it is to be done? To detect these symptoms, what I told you before, by doing cell examination. Thickening, lump, discharge from the nipple, and everything. That is nicely been examined in the cell examination. Now, when it is to be done, it is normally to be done after 6 to 7 days of menstrual period, when the breasts are a little softer. Because before that breasts are engorged, you will get a little odd feeling of the induration. You will not able to know exactly what is happening. So don't do it. It is to be done once in a month. And if you find, and you will not get the idea immediately in 1 or 2 examinations. When you do start persisting every monthly, then you will come to know after at least 8 to 9 times when you do this breast examination, and then you can do the needful accordingly. Hello. Sorry for the disturbance, madam. And after that, when you do the cell breast examination, you see this all particular points and do this every monthly. And after this, you will understand whether what abnormality of the what is the abnormality in the breast, and how we are going to discuss that with the doctor. You will be able to understand. So this cell breast examination is very important. Now I will come to your another question. What are the different forms of the treatment in breast cancer? When we diagnose and stage the disease, and staging is done with the PET scan. Now PET scan is basically a radioisotope study. The FDG glucose goes all over in the body and basically detects the cancer cells. Sugar is very affectionate by the cancers. So it detects the cancers all over the places if it is spread. So once we know that cancer is not spread, then we decide the treatment accordingly. Whether cancer is spread or not, the different forms of treatment will be given to the patient. Say if it is an operable breast cancer. So it is operable, there is no spread in the breast cancer. What we should do is basically, there are 4 different forms of standard treatment in any cancer, and it is applied to the breast cancer. One is a surgery. Number 2 is the chemotherapy. Chemotherapy subtype. Addition, we have targeted therapy. Then we have got immunotherapy also, which has come up. Then in radiation therapy, we have got excellent advanced machines for radiation therapy. And there is another area which is called as intraoperative radiation therapy is also coming up. On the table itself, we do give intraoperative radiation therapy when we do breast conservations. So that is also there. And lastly, the hormonal therapy in the form of tablets when the breast cancer is hormone positive cancer. So these are the different gross forms of overall treatment.
Okay, thank you so much for that. Go on.
If you want to elaborate in details about it, surgery, we normally what we do is basically surgery. We have got 2 forms of treatment. One is a removal of the breast, which is coming from a long time as a gold standard treatment. Number 2 is a breast conservation. Nowadays, what in last 30 years, mastectomy numbers have come down and breast conservation numbers have come up. Now, which lady wants mastectomy? Nobody wants removal of the breast, because unless you are not given the choice, she will accept it if there is no choice. But everybody wants their organ to be preserved, and that is why the new technique which is started 25-30 years back is organ preservation and function. And that is why breast conservation was the first thing to develop in the world by 1990. And they clearly stated in a good selected cases, normally in a good selected cases, we have got a good result equivalent to mastectomy. No much recurrence, no much spread also at the same time. And breast conservation, what it does basically, breast conservation improves or it makes the lady upright in a position by increasing her morals. I think that is more important. And with mastectomy, the scenario is completely different. They are very different. So this is the breast conservation, and especially younger patients, we always do breast conservation in almost all the patients whenever possible. We go to that extent. If the tumor is large, we give chemotherapy, shrink the tumor, and then do the breast conservation and give chemo and radiation therapy after. So this is the surgical modality. Now another modality is chemotherapy. Now chemotherapy modality is what basically? Chemotherapy, these are the injections basically derived from so much of study with the plants and everything. And they put with the trials to the safety of the people. Then they come in the market. Now what chemotherapy does? is chemotherapy adds to the cure for further treatment. Don't consider that chemotherapy is going to trouble. Now in society, chemotherapy has got tremendous fear. Tremendous means tremendous. Doctor of surgery karo radiation do. Chemotherapy madhya. They are worried about the hair loss, which is we don't have a solution up till now. And second thing, the side effects. But I will feel that since years together, initially chemotherapy had a lot of side effects. But nowadays, there are so much of good drugs which has got good antidote for that side effects. Chemotherapy is much, much dull. I'm telling you, unless the patient is very weak, patient is moribund, or patient has got some sort of problems, then only side effects are a little more. Otherwise, the patients, they tolerate very well. In younger patients, we are giving such aggressive chemotherapy, they tolerate it so well. But it will add to your cure. It will add to your wonderful years of the life in future, and definitely will give the good quality of life in later on, because there is no disease which is coming nearby. This is because another thing is hair loss. Now, hair loss, we don't have any option for certain chemotherapies. So what we do, we give them a hair wig, advise them hair wig. They wear the hair wig in the society and they move around. And there's such a good hair wigs are made. Even sometimes we get fumble. There is no hair loss for you. There are such a good hair wigs the people make it nowadays. Second thing, the hair comes back after the treatment 6 months. And they come back much better. I always tell my patients, so you will get much hair and you will look good European Western lady after the chemotherapy. So these are the facts, no question about it. And our aim should be encourage and give positivity to the patient. I know chemotherapy is not a Cadbury chocolate. It's going to give you something, but how you lessen the thing by your treatment and by your counseling. I think that is utmost important in the as an oncologist point of view. Oncologist has to be good psychologist. And lastly, hormone therapy. It is there in radiation therapy. There are the rays which normally give for breast conservation. When you preserve the breast, we have to give breast radiation in that, and that is why radiation. There are so much of good radiation machines have come. There is hardly any side effect nowadays. You can give bilateral radiation both the breast when we have got both sides cancer at one time. We have done that also at the same time without much of a problem. And lastly, the hormone therapy in the form of tablet. We need to take it for at least 5 to 10 years. Depends upon what is your cancer burden in your way. That is how the overall treatments are designed.
Okay, thank you so much for that. And Nisha Rajpal had asked, how does all this affect the mental health of the patient? So I think doctor has already covered a little bit of that. We can probably take it later on. Okay, moving on. I think it's going to come in the next question. The rehabilitation in breast cancer. Doctor, if you could, shed some light on that.
Should we cover before the hereditary breast cancer in details rather than going to rehab, or we don't have time much?
No, we have time. Please carry on.
Yeah. Because rehab comes after the whole thing is over. At the end. So what we'll do, we'll cover with the hereditary breast cancer. I think I was wanting to tell the viewers regarding these things because breast cancer runs in the family. But these cancers, which are happening to the mother, sister, or a daughter, the surrounding people will have double chance, females will have double chance of getting this cancer, which are close blood relatives. But this percentage is around 10 to 15%. And that is why what is our aim is to find out such high-risk individuals which are having these hereditary elements. And these hereditary elements majority times has got a genetic mutation of BRCA1 and BRCA2. These two genes are found out for breast cancer, ovarian cancer, now in pancreatic cancer, also at the same time. So what we do with such evidence, we have a hereditary cancer patient in front of us. If a mother has got a cancer, we do her BRCA1, BRCA2 testing, which is a blood test. Now this blood test shows BRCA positive, then we have to see her daughter to be tested also at the same time. But remember, these studies are not to be done very casually, because if mother is BRCA positive and her daughter comes BRCA positive, it is very difficult for 25-year-old daughter to tell her that you will have more than 80% chance of breast cancer because of genetic element. The genetic element, remember, it is not 100%. It is just 10 to 15%. But we need to
Mhm.
understand this issue because we are getting younger and younger breast cancer, which are triple negative. That is triple hormone negative cancers, which you are getting, which are genetic predisposition, getting BRCA1 and BRCA2 positive. Now, this BRCA1, BRCA2 positive cancers, lady is at most high risk for 80, more than 80% chance to develop a cancer in her lifetime. I think that is utmost important. And these things people doesn't know in the society. When this BRCA1, BRCA2 testing, genetic mutation testing came in the picture, they were very costly, beyond 1 lakh. Now it has come down to almost 15,000. So we normally do BRCA1, BRCA2 and hereditary cancer gene panel for all these patients. And we see that who is at high risk. And for this patient, we keep them under close surveillance by what? Mammography. Sometimes less than 40, breasts are dense. So mammography will not give a great result. So we do MRI mammography in certain cases also at the same time.
Mhm.
So it is sonography of the breast, mammography. Sometimes if it is required, MRI mammography of the breast and the cell breast examination, we keep them under good close surveillance and we check them up all the time. And you must have heard the name of Angelina Jolie, the US actress. She had this BRCA1 genes positive in the family also. She removed her breast at the age of 35 and afterwards the ovary also at the same time. But this concept will not be accepted in India because these are the risk reduction procedures when you have got a classical BRCA1 genetic mutation positive. These are the risk reduction procedure after your childbearing age is done. You said you are removing your both breast. No, we reconstruct the both areas in such a way that your breasts are intact. So it is a mastectomy along with bilateral reconstruction of that breast area, which will not give any problem to them as a cosmetically. Of course, functionally will have issue, but cosmetically they will look good at the same time. That is being taken care of. Sometimes ovaries also been removed in that particular issue. I forgot to tell you one thing in treatment part. Whenever we have a young breast cancer patients, apart from all this treatment, we sometimes the lady is 34, 35 and childbearing is completed. We ask them to remove their ovaries also because or either we medically suppress or we surgically remove. What we want that estrogen is to be suppressed for a long time so that they don't get a recurrence faster. So they get early menopause and that menopause needs to be tackled after. So these are the additional surgical procedures also we do. And this is a hereditary breast cancer. I think that needs to be understood by everyone according to me. And keep in the mind, if you get such people, ask them to talk to the doctor, oncologist, and then do the testing if it's.
Mhm. So I think that answers Mr. Surendra's question that he was talking about earlier. So I think that answers your question. So, doctor, should we now move on to the rehabilitation of breast
Yeah,
cancer?
I would like to focus upon the side effects also treatment for the younger patient. I think it is a
Sure,
big issue I would like to tell you or and
sure.
viewers also the same. Now we know that we do surgical thing. Surgical thing, not much great problem. But whenever you do chemotherapy, ovarian separation, these patients do have some issues. They have fertility issues. Suppose a 31-year-old lady, unmarried, has a breast cancer, you are treated. Now she is going to ask me, can I conceive after that? So that is an important issue, how you talk to them. Then monitor them for 3 years at least. See that there is no evidence of disease, and then you can ask them to go for to conceive also at the same time. So fertility issues need to be addressed. Then menopausal symptoms coming at a very younger age, very
Mm.
problematic. Needs a good counseling for husband and wife together because they do have menopausal symptoms like hot flushes, dryness of vagina, then irritability, loss of understanding issues, fear, all the things are there in their mind. So I think when you are treating young breast cancer patient, you have to be owned as an oncologist with psychologist. Otherwise, keep one counselor or a psychologist proper for this patient because they are to be treated in a very delicate fashion. I have seen a 27-year-old girl post marriage undergoing everything, but was such a bold madam. Fantastic. I always call her my own daughter because she behaved in such a fantastic. I mean, not a single tears in her eyes throughout the. I said, you are
Wow.
hats off. Absolutely. That is why I want to give such examples how the people, what 27-year girl must have felt after the post marriage. Just imagine her boldness. I think we should take something good for them also, because we just cry with any obstacle. Now, how to go through the obstacle is an art. That is why these examples I always give to people. So these are all the side effects needs to be tackled for all, because it's not a Dr. Dudhat has done surgery. No, it is not over. This is how the thing goes. And now your question comes for rehabilitation. Now rehabilitation means what? Dr. Dudhat has done surgery. Dr. Dudhat role is over. No, not at all. You have to get the cancer patient out of the whole thing and make them stand in the society in upright position. That is how rehabilitation. So how you define that? It is making a patient into person, normal person again in the society in an upright fashion. That is how rehabilitation is being defined. Now, how we do rehab? Suppose post-surgical, they have a problem. We tell them about the follow-up. We treat the side effects of the treatment. Then third thing, lymphedema. Whenever you do breast cancer operation, sometimes you have to remove the umpire glands in certain cases. So certain cases, these cases, we do have lymphedema in that extremity. So how to prevent that lymphedema, which is 5 to 6% at present? We tell them all exercises and all do's and don'ts. I think that is one of the rehab. And another thing, psychological, mentally, how they are depressed, everything. So need to come out of that whole phase. I think that is very important. They are depressed, they are irritable, everything. So all this come in rehabilitation. So making that patient into person, I think that is at most important. And what is the winning scene for any oncologist is when patient tells you after 1 year, doctor, have I had a cancer before? I don't remember. I think that is the real crux. And there are certain patient tells me, doctor, itna patient treatment smooth gaya, मुझे लगा ही नहीं इतना problem आ गया. I think these are the all for everybody. How they take the treatment in a very positive way. Now, in positivity, in Marathi we call it as a very good word, sakaratmakata. I think that is extremely important throughout your treatment, throughout your life, not for cancer, for everything.
Absolutely. That is so well said. And I love the way that, you have people coming and telling you that, did I have cancer? That is, I think,
there are certain patients are so doing well and everything. No question about it.
Amazing. So, doctor, do you want to cover the different myths in cancer here?
Yes. Why not? See, there are so much of myths which are there in the breast cancer, in the more of this thing also. Overall cancer, we all them. There is one biggest myth: is cancer contagious? In 21st century also, in today's era of highly educated people ask, doctor, is cancer contagious? Answer is flat no. You can eat with your cancer patient in one thali. I think that is the best answer I can give. So cancer is contagious, one of the myths. But if you look at the breast cancer, this thing, there are certain myths. I don't have family history, so I won't get a cancer, breast cancer. No. There are the cancer which has got a low risk group, which don't have any risk, also they have a cancer. Exact cause sometimes may not be known in that. So that is called as low risk group sporadic cancer. Second is breast cancer is always have pain in breast. As I told you very clearly, it is a painless lump in the breast and not the pain in the breast. Now, it happens only in older women. No. Now we are seeing that breast cancer in younger women. Now, breast cancer happening only in women. It is again a myth. You get male breast cancer also, which is 1%, low percentage. But I'm telling you, last 5 years, it is slow, steadily is increasing. I used to operate 1 in 5 years. Now I have operated 7 cases in last 3 years of male breast cancer. So it is slowly increasing because hormone milieu changing in the males also at the same time. So cell breast examination is applied not only for females, it is applied for the males also. They feel that they don't have breast. No, the tissue which is there below the nipple is considered to be breast tissue, needs to be screened properly. There's no doubt about it. Then there are certain odd myths. Trauma can cause breast cancer. Wearing certain bra can cause breast cancer. No, they don't have any proof. Deodorant in the armpit can cause cancer. There is no proof. There is no evidence. So we should not think in that way. Some dairy products, people feel that having cancer. We don't have any great evidence against to satisfy that. So these are the still myths. There is no proof for that. Go with a scientific thing. Have a good nutritious diet rather than discussing odd things, and rather than You have a time for, people have time for discussing such odd things. But with that odd discussion, if they use it for exercise, I think the 20% of breast cancer will go down with that. I think that is more important.
Oh my God, that is so funny. Any more myths? This is the first. I have never heard of male breast cancer, so this is the first.
Yeah,
Yeah.
that is why I said, I did mention it is 1%, but slow, steady it is coming up slowly. Have you
Okay.
seen any time? I have seen the nipple discharge, bloody nipple discharge from a female breast. I have seen an operated bloody nipple discharge from the male. And it was a duct papilloma.
Oh my God,
Yeah. So
crazy.
that also people should know about it, and they should heal up.
Being here. Yes. Okay. So, any more, or should we move on to the next question?
Next,
Can we
yes,
move
yes,
on
no
to the
problem.
next question? Okay. So, I want to know what are the emotional aspects in breast cancer, depression, denial, irritability, these
No,
kind
no.
of things.
This is how I need to explain that. This is emotional aspects of breast cancer, very important. Overall, they are depressed because any lady telling her a breast cancer is a big, big blow to them. They will not
Yes.
tell you immediately. That's what I do. When I disclose the diagnosis, I disclose in such a delicate way. And I tell them, if at all it is a problem, you cry in front of me, express it out completely. And once you express, the overall burden, the tension goes down. That is more important. Everybody says, don't worry, don't worry. Don't stop their cry initially for a diagnosis. Let them cry. Let the things come out of the mind. And slowly they accept the diagnosis. That is why I always tell all the relatives which are always hyper, even if you do a diagnosis for lady, disclose the diagnosis. Give her 3-4 days to think. Give her a 3-4 days to accept the diagnosis. Don't bombard on her and the doctor, tomorrow you operate this and get rid of cancer. I think relatives are more hyper than the patient. A cancer which is there 2 centimeter is not going to spread in 4 days. Any cancer to become 1 centimeter, it takes 1 year. How it will spread in 7 days? It will not. It is a myth again to the relatives. So relative has to be counseled first, according to me, and then patient is to be counseled later on, because they are more hyper than anybody else. So relatives should take things in a very proper way, support the patient rather making patient in a state of fear. I think that is most important. Then they have irritability, frustration, fear of death. And they know that if the treatment, they should know that if the treatment is being given, they are cured if they are early or operable breast cancers. They have got a lot of questions also. In a young ladies especially, will I able to get along with my partner? Will I able to face my children? Will I able to mix with them properly? In my career, in my office, how I'm going to get along with my colleagues? How they will look at me? Cancer is a stigma in our society, like a tuberculosis. I don't know why. It is not anybody's this, but these are the problems of our society. That's why I always request all the society when I take a lecture, don't point the finger, array, this is cancer patient. Don't do that. Please. And don't make them realize they are cancer patients. If they are treated, talk them like a normal human beings, because there is no cancer in their body. So don't uh, you know uh, put them their name, keep, put a block on that, and don't do that fingering thing. And that
Yeah.
what people doesn't like is a sympathy and other things. So these, I'm telling you, cancer is not only the treatment. You have to treat patient as a whole, not the breast. The patient as a whole, mentally, physically, financially, and everything. And that's why I request everybody, because cancer patient treatment goes little on the higher side. Try to help them, whatever you can help them to the patient. We tell in Marathi, full na fulachi pakki. Help the people in that way. And that's why you can give them a joyful environment. Everybody has the right to take the treatment. In India, I'll tell you, madam, 60% patients cannot take the treatment because they cannot afford. That is how the scenario in India. 60%. So that is why a government is doing quite a good things, but only thing, everybody has to support also at the same time for every patient.
That is so well said. I love the way that you said that the patient has to be treated as a whole. That is beautiful. Can you also tell us the role of counselors and psychologists in this
That I
in this?
already told you. These are the things
Yeah.
which are requiring treatment. There's
Right.
no doubt about it. We already covered that.
Yeah. Do you want to talk about the role of cancer vaccines that have recently
Yeah,
been?
very nice question. Of course, it is not pertaining to breast cancer because we don't have vaccine in breast cancer. The vaccines is billion-dollar research going on for years, decades together now. Now they have devised the vaccine for cervical cancer, not the breast, cervical cancer. Please
Yeah.
remember cervical cancer. Now
Yeah.
the vaccine has been come up in the study and the market around 2000 plus 2001, 2002. Now it is almost like 15, 20 years now. And this vaccine is when it came to the market, everybody called us, doctor, can we take it? That time there was no much study initially. But then the two target group came. One is 9 to 26, 9 years to 26 years before first sexual exposure. You will have maximum immunity more than 90%. Then the second group study came 26 to 45 after sexual exposure. Immunity is around 70%. No much of a side effects. Can take it. It is included in immunization schedule, but an optional because cost is little more. 2,500 per one vaccine, and we have to take 3 doses like hepatitis B 016. Now, who gives in adult gynecologist in less than 18 years pediatrician? So you can safely take it to prevent the cervical cancer. There is no doubt. But other
Mm-hmm.
vaccines are in pipeline, but study has to come to prove their efficacy. I think that is utmost. But I am telling you, after 50 years, the treatment will so much of change. I think even the cancer surgeon also will be on the back foot. Everything will be in gene replacement, something which is advanced. So even chemotherapy will go back, something else will come, and I think we will be in a different era of cancer treatment after 30 to 50 years. Advances are so much of happening. Every 1 monthly we are getting something new medicines. Every 1 monthly we are seeing new approach in the cancer treatment. It's moving very fast.
I'm into that. Absolutely. That is the need of the hour. Okay. Could you tell us a little bit about the follow-up treatments?
Yeah, follow up basically very important. Whenever the treatment is over, we need to screen them properly every few months. Why? Because any cancer, even if it is curable, on the back of the mind, I tell them there is some percentage of recurrence may be there. It may come, it may not come. And when it comes, we really don't. Recurrence is a absolutely different ballgame. So we need to see them very closely. In first year, we see them if they are in the cities 3 monthly, 2 to 5 years, 6 monthly. And after 5 years, every 1 yearly, we examine them and we do mammography, sonography, everything for the patient, as well as the pap smear also routinely in younger patients. So this is how the follow-up being treated. Always remember, follow is important. Doctor is not calling you for the sake. It is important because certain things recurrence investigation will not tell you. The node which is enlarged here, only doctor can diagnose. Your investigation cannot diagnose. So always remember that follow-up is very important. You have to go. How we go to the mall and theater regularly? Why not to do one follow-up? Cancel one visit of mall or theater and go to the doctor at the same. Everything is possible. You should be Napoleon Bonaparte. Nothing is impossible. So you have to follow in that.
Right. Okay. Could you tell us about the prevention? Because that is, I
Very
think,
important. That is a crux of the whole thing also. How the cause is and how you prevent it. Now, always I tell everybody, stay healthy mentally and physically. That is backbone of the whole thing. That is more important. You should have good thoughts, positivity, compulsory, no question about it. Good
yeah.
nutrition, eat home food, well cooked food. Don't go for this fast food. I don't say don't eat it, but what frequency that you must see. Very rarely you should have. You should have healthy, stress-free lifestyle. Good exercise, 1 hour every day will reduce your chance of breast cancer by 15 to 20%. Remember that. I'm telling by the statistics, not my opinion. And another thing, yoga meditation. You give 2 hours to your body compulsorily all. I think that is most important to give the rejuvenation of the whole. Now, as we know that, avoid smoking, avoid alcohol, stop it everything if you are taking it. Then other things, how we see changing of lifestyle, see the career, and then see if you are having the career late marriage, you will have late pregnancy. So if you can try to revert that before 30 marriage, before 31st pregnancy, will add to your much better prevention. Good breastfeeding, at least for a year or two, very important for the people. And reduction of body weight. Obesity one should not have. Absolutely remain thin. That's what I feel. Fat should be very less, and eat low fat diet and good exercise with good yoga meditation with good thought. I think life is very good in front of you. Enjoy that. Life comes once only.
That is amazing. That is, I think all this is doable because now people are becoming very, very, conscious about their health, and I think this is very, very doable. So,
I think it will improve when they have understood their own faults. Na? I think people are going to improve about it. And
yes,
I am going to tell the young viewers, I am telling you for the females and the males, the sleeping
right,
habits should be improved. They sleep at 3 o'clock, get up at 9 o'clock, 11 o'clock. What are the wrong habits? Absolutely. That causes body damage. So older ancient things was very happy. Lavkar nize ani lavkar uthe. Getting to the sleep by 11:30, getting up by 5:30, 6 o'clock. 7 hours
right,
sleep is essential. Get up, good exercise, and then you get out of the pool. Don't go, don't take the breakfast. Keep an habit that without exercise, I will not eat my breakfast.
right. Amazing. There is a question from Smita Khare. She
Yes.
wants to know after what age one should do a mammogram as a health checkup.
If there is a no risk in the family, no familial or hereditary cancers, you can start mammography by age of 40. Every year you can do it. Later on 50, you can go for 2 yearly. But I would suggest in an era of increasing breast cancer, make it every yearly. Not only mammography plus sonography of the breast. And please show it to your concerned oncologist. Don't do it on your own whole reading. Even if the report is normal, show it to the oncologist. I'm telling you because I have seen problems despite of report normal, clinician finds it little different, which cannot be sometimes picked up in mammography and picked up in a clinical examination. So please don't do that. No self-investigation. Doctor has to be with you all the time.
Okay. There is another question from Shobha Day. What is your say on regular mammograms? Does it have any side effects?
See, they have said regular mammograph, sometimes X-ray exposure, but X-ray exposure is very less. But if you are really having that issue or fear of that, if it is low risk group, when there is no history, pregnancy before 30 age, everything at the right point, then you can do alternate year mammography. First 10 years you do regular, and after that alternate year mammography and with sonography of the breast, and other year you do only sonography. So 1 year mammography with sonomammography, next year only sonography, next year again mammography with sonomammography, alternate.
Okay.
You can do
Okay.
it.
Okay.
You
That
can
sounds
do it
good.
up to 70, 75. There is no age bar because if you are fit at the age 80, you can do it because as age increases, the incidence of breast cancer increases. And we feel that अरे मेरी उम्र 75 हो गया अभी मेरे को क्या होने वाला है उसमें फिर breast cancer हो जाता. So always remember, never ignore the things in life.
Okay. Okay. So, but you think, okay, there is one more question from Mona Rathore, means a 40, a 50-year-old person, every year one must do this every alternate day. I mean, we have to do
Alternate
that regular.
year.
We have to do the
Yes,
examinations
but
every year.
mammography has to be done. Cell breast examination is to be continued from age of 20 onwards till the last day of the life. I think that is most important. You won't believe, I have seen such a intelligent old females with a 75, 72, small lesion. They have showed me, doctor, I was examining my breast. I found out this. I did the biopsy. It came positive. And that these ladies are doing so well because they are diagnosed in a very. But how many ladies are active in this particular mentally for that? That
Right.
is their sons and daughters. This thing that they should have close attention for this senior citizen according.
Okay. That is good. So, Doctor, would you like to give our viewers any last message? If we have any more questions, we'll take that up. But
We'll
if
take
you,
it accordingly. Otherwise, I'll put a message at the last. No problem at all. See, I'll tell you one thing. I always tell to my viewers, life comes only once. There is
yeah,
punarjanma. We don't know really because I have not. I don't have any proof for that. So if the life is once, always remember how to live life is an art. How much I should live, it is not in our hands. But how I am going to live my life, that is very important. In a quality of life, that is very important. Obstacles are going to come. There will be obstacle in front of you. But how to accept the obstacle in a graceful way. I'm telling you, the three sutri. Height of patience you should have, acceptance of obstacle in a graceful way, and third is a sacrifice. No sorrow will touch you. That is how one's life should be. Any obstacle stood in front of him, make them friends, take a chai with them, make them friends, laugh with them, will not touch you at all. Because we take more fear of the obstacle rather than overcoming it. So do it in the reverse. Fight it out properly. So if the person is going to come to hit you, you are not going to go back. You are going to counteract that action. I think that is more important. Circumstances which are not going to change, you should accept that. And the circumstances which are going to change in such a good way that you will be able to overcome the obstacle. And that is why signs of positivity you should give to your mind, that I am going to take the treatment, I am going to be cured, and these are the positivity signals will take you to the victory towards the cancer. I am telling you, one of my patient, who is a very great lady, my precious patient, DUDHAT SANJAY, had a breast cancer at the age of 36, very high grade cancer. 2006, touch wood, till today she is alive because of the good aggressive treatment and her positivity. She got 7 awards after the cancer treatment. She is a teacher in the BMC. She got state award, national award, international awards. Fantastically, she is doing everywhere in Maharashtra the work, as well as the counselor too. She has sent me a very good message. I said I must give it to the viewers. She says, wisdom is to acknowledge the fact that cancer is not the entire movie. Cancer is not the entire movie, but a short scene in it. Treat it as a short scene. A scene where you fight like a warrior, because then only we can call ourselves as a survivors. Warriors and survivors. Once you become warrior, then you will become a survivor. Fantastic. Wow. Fight for it. Get the things out of the whole thing. We have got a fantastic advanced treatments are available. We have to take the advantage of it. And what is then crucial for any patient is the right time and the approach in the right place. I think that is the last message I would like to give.
Beautiful. That is so well said. That is, absolutely amazing. Okay, there is one long question. So,
Yes.
Anmol Padesi says, hi, I have 2 questions. Among the causes of mortality in India, what is the burden of cancer? If you like to take that. And okay, isn't ischemic heart disease a leading cause of mortality?
Well, basically, these two diseases are totally different. We should not right now discuss this, because that is one of the cause as a heart disease point of view. Now, ischemic cause, yes, these are the important issues nowadays, and they are increasing because we have got a bad habits like smoking. Smoking is one of the factor which will cause the ischemic heart disease, and your stress and your work style. These are the 3 important reasons to have myocardial infarction. We have seen, no, suddenly going to the gym, suddenly collapse and died. One walking died, sleep died. What happens? It is your lifestyle which reflects the whole. If you are stress-free lifestyle with exercise, with control, I don't think a people will land up for MI majority. I don't say. Everything has an exception. I do understand. But these are the things. But if you look at the cancer is increasing day by day. And we have got almost 18 lakhs new patients in India. Now it is going to be 45 lakhs by the year of 2050. I think 45 lakhs new patients to treat every year. We don't have that much of cancer centers in India. Only we have got 600 cancer centers in India, which we require much more the whole thing with. And if the lifestyle goes like this, what we predict is an epidemic of cancer by 2050. I think that thing should not come. We should break this prediction according to. So, epidemic of cancer will be very difficult if this lifestyle continues. We don't want it now. This is, of course, this is one of the predictions with the oncologist and the study of everything which is happening all over the world. But we need to improve ourselves, introspect ourselves, see that where I am going wrong. Don't try to compete with others. compete with yourself. Don't try to trick the stress unnecessarily. Even if the stress is going to be there, then learn coping of stress. How to cope up with the stress is an art. Everybody cannot cope up, and they land up in cancer, they land up in diabetes, they land up in myocardial infarctions and all those things. That is how it is. So finally comes down to follow your ancient lifestyle. I think most important 50 years back.
Yes, like so true, because they say like you said, get up, sleep early and get up early. So follow the circadian cycles, and I think that'll
Right?
this. Okay, there is
Food
part
at
two
the
to
right
this.
time. Food at the right time also equally important.
Yes. There is another question. I mean, same question from Mr. Anmol. Are there any city or state-based cancer registries existing in India to keep a track of incidence and prevalence?
Yeah. We have the cancer registry in Mumbai also. We have in Delhi also. We have got a Indian Council of Medical Research, which is keeping the whole cancer registry also. And they are every
Okay.
year they are giving the statistics and everything. ICMR also doing very good job, no doubt.
Okay. Amazing.
But only thing,
So,
what happens? So many cancer patients you have, they should able to register properly. Which are sometimes they don't register. They are advanced stages. They die without having any. These patients are not winning. That is why I said real statistics will be more in India. What we are projecting right now.
okay. So I think doctor has answered all the questions that were addressed here, and this was a very beautiful, very informative, very precise, concise conversation that you had. Everything from the causes to preventions to rehabilitation, everything. So thank you so much, doctor, for doing this. We are absolutely honored that you could come to our platform in spite your busy schedule and do this for us at such short notice. Thank you so
Thank
much.
you so much for giving me this platform, and thank you all the viewers which have done the which they have listened to the whole 1 hour. Thank you very much for them also. But only thing, my request, listen to that, but please follow it and execute. I think that is more.
Right. Thank you so much. And Alaknanda again says thank you so much. Very informative session. Dr. Shweta Dudhat says amazing. What a great way to boost the cancer patients. And there are a whole lot of other information. Anisha Rajpal says positive approach is very important. Surendra Khade says thank you so much for all the things were very well explained. Yes, thank you so much. So, okay, there are
Thank you
more
so much.
comments. Thank you,
Thank
doctor.
you
Okay,
for being
thank,
a great anchor. Wonderful. Thank you so much. Thank you so much.
thank you. Thank you so much,
Thank you.
doctor. Thank you.